Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Joining me today is Dr. Joel Bennett, President of Organizational Wellness and Learning Systems, aka OWLS, OWLS, a consulting firm specializing in evidence-based wellness and e-learning technologies that promote organizational health and employee well-being. Dr. Bennett first delivered stress management programming in 1985. Since then, OWLS programs have reached nearly 250,000 workers across the United States and internationally. Joel is the primary developer of team awareness and team resilience, evidence-based culture of health programs recognized by the U.S. Department of Health and Surgeon General for reducing employee behavioral risks. He joins us today from North Texas. Hey, Joel.
Hi, and may I call you Charles?
You may. In fact, I insist. And I should say, full disclosure, Joel is a bud, which doesn't mean you should get too comfortable, Joel. Actually, on the contrary, this gives me a context and excuse to ask you questions I wouldn't ordinarily ask.
Uh-oh.
Yes. Yeah. So just letting you know. I mean, it's going to be a normal podcast conversation, asking you some standard questions, but you never know.
Yeah.
You never know. I may throw you a curveball. I even may throw you a knuckle curve.
Yes,
I do have that in the
We're going to devolve into baseball statistics quite easily here, I think.
When I speak with you, I'm always tempted to go into these digressions. I know you grew up in Far Rockaway.
That is
correct. Now I associate Far Rockaway with three things, with Joel Bennett is actually the birthplace of the great physicist Richard Feynman, and it had an amazing batting cage that I used to go to.
Yes.
So
there are other notorious people from there too, which we will.
Anybody immediately comes to mind?
Who was involved in the great Ponzi scheme?
Oh, Mr. Bernie Madoff.
Mm-hmm.
Wow.
Well, Rockaway. I'll never downplay the influence that had on my life.
I thought you were going to break into a Ramones song.
Well, that's the other reference. Yeah, there's a lot to Far Rockaway. Yes. So anyway, here we are, long time since then.
Yes, indeed. Anyway, Joel, I really do appreciate your taking the time. So what I really want to talk with you today is this program that you developed, which is really fascinating. It's called the Ripple Effect. So right out of the gate, let me ask you, what is it? How did you develop it? Who needs it? And why?
So quickly, and we have a lot of content out there that we can reference here, other YouTube and writings. So the Ripple Effect is an adapted program, which means it can be modified and adapted, that has classroom-based training with a workbook for groups of individuals, employees, community members, or both. And it's generally delivered in a 2 to 3 hour context. And it's designed to promote social capital amongst the people who are attending in a way that allows them to understand that they have an influence on the community and the health of the community around them. That's basically what it's about. And to recognize the power of community and the power of social capital. The modules cover things like the difference between the we in wellness and the I in illness, the importance of standing up for your values, understanding the difference between individual and team resilience, really listening exercises, and making healthy decisions like, should I speak up or not speak up? Should I reach out for help or not reach out for help? And it walks people through these various areas of content in paired interaction, group discussion. That's what it is. And what it does, our outcomes include things like recognizing that I have a positive influence on others and others have a positive influence on me. I have stress management skills that I didn't have before. I have more communication skills than I had before. But most importantly, what it also does is create a climate that is what I would call a wellness climate. It's a psychologically safe climate where it's okay to speak up and to do that in a way that's mindful. That's what it is. Why we need this should be obvious. There's a lot of social divisiveness. There's a lot of political divisiveness. There's a lot of burnout. People, as we know, the Surgeon General a couple of years ago issued a report on the loneliness epidemic. COVID had a accelerative effect on some of these social inequities, but they've always been there. So it's very much needed. Most importantly, why I think it's needed is that the vast majority of programs that are provided for mental health improvement tend to focus on the individual level and tend to be more reactive or treatment oriented and don't focus on the power of the team, the power of the group, the power of the crew, and the importance of proactive and preventative efforts. So it's different than what's typically provided, and that's a nutshell description.
Yeah, no, yeah, it was very good. In fact, you touched on just about all the questions I want to ask, but I do want to unpack some of those components. And I think it really is interesting. And you're right that very few of these that I've come across focus on the team, the social capital idea. You use the term collective efficacy. First question I want to ask, actually, and it didn't occur to me when I was thinking about this to actually ask this, but I think it's important. How does one assemble those teams? How you mentioned the various delivery modalities, if you will, but how is it delivered in such a way that you have a team that's participating in this?
Yeah, there's more than one way that has occurred over the years. We've been doing some version of this for 20 years. And so we have run the gamut from delivering this to intact work groups to, in a number of instances, where we work with department heads or supervisors or HR to assemble people together who are representative of different departments. So there's this kind of a hybrid approach where we make sure that people across the organization come together to get to know each other. We have also done it with communities where people from different organizations come together. We've conducted this in a library, for example, or in a public setting. We did this in one example comes to mind to show you the range. We did this in a pavilion, in a outdoor pavilion next to a public park. And the people who came represented different healthcare organizations from the community. There was people who represented the local museum and people from different workplaces, including planning and development. And somebody showed up who happened to have their kids there for a local baseball game, going to baseball, who was a veteran. And he just walked in and was very powerful experience for us. So the idea of the ripple effect is that it's kind of like just the name itself. It's not insular, right? It's meant for anybody, and it's meant to be designed so that it can be experienced in a boundaryless way, because the whole point of social capital, and we could talk about the corporate idea of what's the word that they use? It's not social capital, it's just slipping my mind, where the business is thinking about its impact on the community and the role it plays in creating community health and well-being, so that it's more porous. But the point, answer your question, it's across the board, the way this is rolled out in many different ways.
So just to back up, in your words, the program is based on the premise that the best predictor of health and recovery are some things you've already mentioned: community, connection, belonging, social capital, collective efficacy. What exactly is, I know you mentioned several times social capital. What exactly is, I know what community is, I know what connection is, I know what belonging is. What exactly is social capital?
Well, that's a great question. And I just want to reiterate what you said, because I think it's so important. One of the best predictors of health and well-being, mental health especially, is social connection, belonging, a sense of support, social support, and that includes in the workplace, coworker and supervisor support. So I just want to reiterate that. Social capital was used by this researcher named Robert Putnam. He was the person who brought it to light. It's been around before him. And he wrote a book that was very popular I think in the 90s, called Bowling Alone. And last year, a movie came out on Netflix that featured a lot of the work on social capital called Join or Die. And I'm not going to give you the academic definition, but essentially, social capital means people who are working together for the greater good in some sort of local community setting. So the examples that were originally used were things like people coming together for bowling leagues, right? Knitting clubs, the Rotary Club, things like that. Those are examples. And what the name capital was added to it because it's different than what we call economic capital or political capital. And one of the things that Putnam found was that social capital was a centerpiece of a healthy democracy. And this was actually taken up by people in the White House earlier on, not the current White House, but previously. And he was featured as a speaker, and I think he may even have spoken to the Senate at one point. So social capital is taking the idea of belonging, connection, and moving it into the interface between health and mental health and well-being and the civic sphere, right? The civic sphere. That's really where I understand it to have its nuanced difference between that and things like social support. Just so that's a definition.
And where does social capital end and collective efficacy
Okay.
begin?
There's so many, there are all these different, there's this whole nomenclature, right? All these different distinctions that I think, I'm not sure it's an academic argument here as much as it's important that the bottom line of that any one of these things, collective efficacy, team awareness, social support, belonging, social capital, they overlap with each other, right? They're not distinct from each other. They overlap with each other.
Yeah,
Albert,
because I imagine, I'm sorry,
yeah,
because the idea of capital and efficacy seems to me to sort of go hand in glove, because capital, to my mind, is the accumulation, say, of resources, of assets. It gives you some agency, some discretion. Now you have something that you can use
that's
to
right.
purchase something. And efficacy, of course, is once you've purchased something, now you have some influence over that particular situation, again, which goes back to agency. So I see how they go hand in glove and to some extent where the delineation is.
Yeah, I mean, you'll remember we had a conversation toward the tail end of COVID where you were on this whole thing on belonging, right? And you wanted to
Right.
create some sort of platform and even an app, or I remember, one of your crazy ideas. and and so that came out of what was happening as a result of COVID, right? And also what was happening with the emergence of Trumpism and a lot of the political divisiveness that was occurring. And so I think what we're talking about here is to what end are we coming together? And you can witness recent events with what people are calling an overreach of the Department of Homeland Security, and how people are coming together to bring more voice and empowerment to represent the idea of human rights and civil responsibility. And so collective efficacy, just to come back to the question, Albert Bandura was the researcher who coined the term self-efficacy and collective efficacy, although later. Self-efficacy has one of the most widely used constructs in the research in psychology, that we know that we want people to have agency. We want them to feel effective. We want them to feel they have an internal locus of control where they can be effective. And that is also a measure of mental health, right? If I don't have self-efficacy, if I don't feel like I'm the captain of my own ship and I have control, then I'm more prone to anxiety, depression, and a whole variety of mental health sequelae, right? So what he said was that collective efficacy is as important and even more important when it comes to the social world. But what we have seen is the most predominant area of work has been on self-efficacy. the research has been done, the focus has been done, and this is a bias that I can talk about other biases. It's one of the biases that exist in our individualistic culture. And so until crises occur, right, like Katrina, 9/11, COVID, or, governmental overreach, people will always revert to the norm of I'm the captain of my own ship. But once the crises occur, people kind of band together and say, we got to do something here, So they start tapping into the collective efficacy, but it's often episodic, right? It's more often reactive. So the idea that we're talking about, it doesn't have to be reactive. We don't have to wait for the crises to occur to build this social capital muscle. We don't have to wait for, quote, the shit to hit the fan. And we live in a culture that's very reactive to that. So collective efficacy is sort of like the psychological, the group psychological component of social capital.
It sort of is the catalyst. It's sort of like,
There's the word, catalyst.
Yeah, there you go. Collective action. That word, I think, is within our politics and sociology. It's about how people gather to actually move in unison to achieve a goal that would otherwise be hard to achieve if you're just doing it in an individual way. So it seems to me that collective efficacy and collective action, there's a lot of overlap there. Also, you mentioned belonging, conversations we were having during COVID. And it occurred to me, the reason that was such a powerful concept, it goes back to the word empowerment, because everybody at that time was talking about inclusion, but it struck me that inclusion, although now it's obviously a dirty word, so I'm not supposed to use that word, but inclusion didn't go far enough. Inclusion is being in the room. Belonging is to be at the table.
That's
so
right.
You have that empowerment, you have that efficacy, you have that agency. So it's taking it that extra step. So that makes perfect sense. So what have the results been thus far with this program?
Well, I mentioned some of them earlier, improved stress management, because we talk about resilience within it, improved communication, improved sense of community, improved sense of feeling like one is contributing to others, right? Those are what we find in the ripple effect. But remember, ripple effect is an adapted program that's part of a broader team awareness, team resilience approach. And there we've seen improved EAP utilization. We've seen reductions in problem drinking. Because we've seen this in cluster randomized trials and clinical trials, and we've seen it over the years, including some recent publications, I'm fairly confident that we can get at least a 10% reduction in problem drinking in any workforce. For example, as one indicator, we know the cost of problem drinking when you have it in an employee population, for example. And we can calculate that out. There's estimators out there that's been, I'm sure, with this particular podcast and the role of addiction and substance abuse and mental health. So what I know then is I can then estimate the return on investment. So when we talk about outcomes, there's the direct outcomes, but then how does that translate into business outcomes? And, we're talking at least a $3 to every dollar spent for that one outcome. And in certain occupations, problem drinking is a significant issue. But we've also seen counterproductivity. We did a study where we asked, how much time are you taking, not working? Are you, blowing things off? Are you not being safe? We saw improvements in that. We have also seen improved supervisor responsiveness to employees who are having a difficult time. I mentioned earlier, making healthy decisions. Very often, and this is a major issue which goes beyond just this issue of mental health, but how do workplaces deal with employees going through a hard time? How do the coworkers deal with it? How do supervisors deal with it? How does HR deal with it? That's becoming a much more difficult process to negotiate with remote work, with the advent of AI, with all the other things that I'm sure, you talk about. And so what we really believe is that, and we've seen it, is that you cannot create that climate which this is the key thing. You cannot create a positive climate but without bringing people together to talk. It's just not
Right.
going to happen.
Right.
And so what happens is supervisors are left with, I don't know what to do here when, I'm on a call with the employee and it's obviously there's something going on with that, where their speech is different. They may even have a black eye, who knows what it is. It could be something going on and you don't know what to do. And so what this does, I mean, I use the term organizational intimacy. It's another construct here. When you are in a culture where it's okay to speak up, where people are relatively healthy, where you don't feel resentful all the time because of the way you're treated, where the other concept here is moral strain, and the opposite of organizational justice. When you're in a climate, a local climate, where people feel that that's okay, then it's much easier to say to the coworker, hey, what's going on? It's much easier to recognize the importance of using the EAP. It's much easier to look at HR as an ally rather than as the enemy. So that's what we're doing with all this work. That's the
Yeah.
work of the ripple effect.
Yeah. It feels almost like simultaneously the need for the solution is also the barrier to success, which is to say, in this particular environment, you mentioned loneliness, and obviously in a post-COVID world, you have people who are working in hybrid arrangements. You don't have that organizational intimacy that you may once have had. So this model is premised on bringing together perhaps disparate elements of a team. Even if they are part of a team, they may be working from different locations. They may be united in a shared goal, but they don't know each other very well. So that's one thing you need to overcome. That's one thing you're looking to
Well,
bring together.
that's what we do. That's exactly what this does. Yes. Yeah.
So,
And it has an impact. I mean, people then, as a result, we did a study with a client where people start to believe that the organization is more resilient. And that's such an important piece that when you populate these groups together, and we do it all virtually too, right? This particular case study, and we published on it, was virtual. And what we found was that before this was an organization that was about to go through a merger and acquisition. And so let's put this in context, because that's a lot of the other thing that's going on right now. A lot of stressors around the uncertainty, job uncertainty, and what's going to happen next. When is the other shoe going to drop?
right.
And even during that period, or at the onset of that period, people were like, are we going to make it? Not just me, but is the company going to make it? Are we going to be able to get through this? And what we found is that when you do this, people start to realize, we're a stronger team than we realized. We're more resilient at the organizational level than we realized. And that is what we're not paying attention to. We're focusing only on the individual resilience with most studies. And God knows we need to see ourselves not just at the individual level, organizational level, or community level, but at the national level as well, going back to social capital, as being able to get through this.
Oh, yes. Yes.
So,
So the program consists of six models. Six modules.
yeah, this one, yes, it does. Yes.
And you'd mentioned the fourth module, making tough decisions. You referred to making healthy decisions. Is this one and the same, or are these two different things?
They're the same thing. I mean, we actually have a recording, which we did a webinar recently, and whenever I do webinars, I always give a sample exercise for people to walk through. And one of the things that we learned early on is the importance of giving groups the activity of a cost benefit analysis, where you say, what are the costs and benefits of doing X versus Y, right? And the original, just to kind of give you an example of this, and we did dozens and dozens of times, just as an example, I'm a supervisor and I know that there's an employee who is, for lack of a better word, troublesome. Let's say we know that he or she has a drinking problem. What are the costs and benefits of saying something to that employee, taking action, and what are the costs and benefits of doing nothing? And when I sit down with managers, and I've done this, which is great because you bring managers together from different departments and you just listen to them and you flip chart what they say. And what comes out is like almost like, thank God somebody's asking me this question.
Right.
Because they start sharing with each other. This is what I mean. They start sharing with each other things, their tricks of the trade, resentments that they've had because they had an employee that they trusted and no longer. They talk about how they didn't use the EAP and why they didn't. They talk about why they did. And so you're starting to get into what I would call the heart of the matter. So what happened was we started to realize, well, there's lots of different costs and benefit grids we could create. So for this particular program, we created 3. One, and there's a lot to this, Charles, so I'll just go very quickly and then we can unpack it. One is, what's the cost and benefits? If I'm having problems, psychological problems, myself or my family, what are the costs and benefits of reaching out for help versus going it alone? That's the first one. And then we put people together in a group and we say, just write it out, talk about it. Then we do, what are the costs and benefits of the one I just mentioned? You have a coworker who is causing problems for the group. What's the cost and benefits of trying to do something versus doing nothing? And then the last one, which is the one that I love, what we did was, what if there's a problem, an elephant in the room, in the group, in the organization that nobody's talking about? Nobody wants to talk about it. What are the costs and benefits of speaking up or remaining silent? And when we did this the week ago, in the most recent version, I was in a group and the person, because it's all confidential. I have to say, everything we do is always done and we always lay the groundwork of confidentiality. What's said here stays here. And what this person said was they had a new supervisor come in. Things got changed. People were afraid to speak up. And this coworker said they started to see people take sick leave. They started developing ulcers. They started to complain more. It is very significant when the climate isn't healthy. And
Sure.
and so the benefit for speaking up there is to address it. But there's costs to speaking up. The point of all of these 3 different decision grids, I hope I'm, not getting too into the weeds here, is we never say you should reach out for help. We never say you should talk to the coworker. We never say you should speak up. Instead, we say, this is a decision you have to make. It's not an easy decision. And when you do think about it, when you really have the conversation and you are discerning and mindful, you will draw on qualities of team resilience. And so it's not designed to, it's not a didactic training. It kind of goes we get underneath the skin, if you will. And so we're talking about when you are making the decision, not having made the decision, but the process of working with, the process of working through, to use a psychoanalytic term, when you go through the process of working through, should I reach out for help or should I go it alone? You're drawing on the quality of centering. When you are working through the decision, should I speak to this coworker or not? You're drawing on the quality of compassion. And when you're working through the decision, should we speak up about this, be the whistleblower or not? You're tapping into the quality of confidence. So centering, compassion, and confidence are 3 of the 5 C's of team resilience. The other ones are community and commitment. So the point of the framework and the model, and we have been acknowledged for this model in reviews of our research, is that you're building awareness that resilience occurs at the team level, that collective efficacy is as real as individual efficacy. And you're now part of, and like you said, you have a place at the table.
Right.
And that is a very powerful driver of health and well-being.
Very interesting stuff, Joel. So there are 6 modules. You say it could be delivered on site, virtually, workbooks, and so forth. Can this be done all in a single session, several sessions? How is it typically done?
Well, typically we take the 3 hours and we try to knock it out, but there's an advantage to doing it across 2 or 3 sessions. I'll tell you the ideal setting, the ideal for us is, again, this is for community as well as workplace and the interface. The ideal for us is to sit down with whoever is the organizer and work through who should be coming to this, and then to populate the sessions. Because remember, we're not only, ideally, we're talking about 15 to 25 people, right? It's not for a large group to get the level of interaction that we're talking about. We can do it for larger. We have done it for larger in a classroom setting. And so here's the thing. It's how you go about putting people together is as important. And we call that the social architecture of the training. I don't want to overcomplicate it. Some people just throw people together, but what we have found is that if you're taking 3 people from this department and 3 people from that department and 3 people from this department, and you're thinking about who you're bringing in, that makes a difference. So what that means is between session 1 and session 2, you have assignments, and that helps further entrench the climate piece that I'm talking about. So ideally, it's a multi-session where it's maybe 3 one-hour sessions a week apart with buddy assignments in between. That's
right.
ideal.
So that's optimal. Right. Yeah, it would seem so. So last question. You say that the ripple effect, while you do refer to as training in your literature, in the presentation that I've seen, you say that it's not just a training, it's a movement toward healthier workplaces, stronger communities, and a more connected future, an ambitious goal. How does this go from training to a movement? What has to happen?
Oh, well, that's where you come in, Charles. I was hoping in this podcast that everybody will hear that I'm going to enlist you as our spokesperson. You fed right into my plan.
Oh no. Oh no. Oh no. This is diabolical, Joel.
It is. Well, you know me better. Anyway, it's a tough question. I mean, the forces are so biased toward the individual level that I don't use the word movement very much. God rest Jesse Jackson. I don't think there's any other way to do it than just doing it. You know,
right.
You just have to build momentum. You know, we've been very fortunate in upstate New York. We've had dual funding from in 2 or 3 different agencies up there. So I'll share that model. One funding source was from the Office of Substance Abuse and Addiction Services, which is the New York State Department of Health branch that focuses on funneling federal funds for prevention, substance abuse, and mental health. We also had support from the Appalachian Regional Commission to the New York Southern Tier Economic Development. And because of those 2 sources of funding, we've been working with nonprofits throughout the Southern Tier and also in the Finger Lakes region as well to build capacity. So it's a long answer, but very quickly, it's more likely to become a movement when 3 things happen. 1, you have interest from economic development, not just from public health. When people see this as an economic issue, and fortunately, because of the opioid epidemic, people started to recognize that substance abuse and misuse is an economic issue, even though alcohol is a bigger economic impact, but that's a whole
Yeah.
nother number one. Number two, you have a long runway for capacity building where you can do key informant interviews, stakeholder interviews with public figures. So we interviewed heads of chambers of commerce, heads of workforce development, and people who have a civic facing, responsibility interfacing between the business community and the community at large. Those are key people, directors of public health in counties, and you interview them and you get their interest and you build that capacity. Number two.
Yeah.
The third thing is, of course, funding. The people who provide this need to have enough FTE over a longer period of time to get out there and do this. Fortunately, that has happened across my career. That's happened over different periods of time in different ways, but that's how you make it happen. I've not seen it happen from a grassroots perspective ever. You have to have certain things coming together to make it happen, to move it to that next level. That's my
Yeah.
experience.
Yeah. I think most things need to be top down. And at some point, it becomes perhaps grass level. I think when you use the term movement, it may be a little bit problematic because it sounds lofty and sort of out of reach, perhaps aspirational is the best way to put it.
Yeah.
But I think in a better way to put it, because what you're talking about makes a lot of sense in moving from the individual to the group, to the collective. And in this day and age where so much of our society is atomized, people are working and here, there, and everywhere. There's, as you mentioned, there is an epidemic of loneliness, et cetera. So it makes a lot of sense. So I'm not sure if it necessarily requires a movement for all these things to cohere and to gain momentum. It just needs to really make sense. And it does make sense.
But you have to take the time for it.
Yes.
It takes,
yes.
it's that's what's the biggest bias toward the individual is it's easy. That's the way the culture is set up.
Yeah.
It's convenient. It's where the economics are. So
yeah, and by the way, when I say that, voila, it just makes sense. I mean, to even get to that point is difficult. But again, I think when you present it in that way, it seems a little bit more approachable and attainable. Because, quite frankly, as you unpack and describe it as you have in the last half hour we've been talking, to my mind, it makes a lot of sense.
well, let's just talk about whether the current zeitgeist has an appetite for something that makes sense.
Well, yeah, it's kind of interesting because in one time in my career, I had something legitimately go viral. And anytime I hear somebody trying to intentionally make something go viral, I say it doesn't happen like that. Even that one instance that I wrote something that went viral, several things had to come together. And some of these things were kind of unlikely, but they all came together magically. Some of it was intentional. It's like the Branch Rickey definition of luck, when preparedness meets opportunity, however that goes. So all these things do need to be together. Some of it's intentional, but some of it, quite frankly, is dumb luck. That's the accelerant. That's when it really happens, and you have to hope that confluence at some point happens. But again, just the level of what you're saying makes sense, particularly in this moment that we're experiencing. I think you're looking at it with great clarity and insight. And, I wish you all the luck with this, Joel.
Well, I got to be honest. It's the research. This was not. It's just looking at the data, right? I mean, I've been guided through science to get to this point, not through, some wild hair. It's just what the science says. I
No,
mean,
that's what makes you and me. I mean, you're guided by the science. I'm guided by, a friend of
humor.
mine who's an engineer used to tell me he is guided by the empirical method. And he would ask me, Charles, you know what the empirical method is? And I say, no, Leo, what's the empirical method? He said, the empirical method is flying by the seat of your pants. So I'm I fully embrace the empirical method.
Well, I'm
But
happy to fly along on the ride, to be on the ride
yes,
with you.
indeed. Joel, thanks so much. Really do appreciate you taking the time with me today.
Yeah, you're welcome.
Today, I spoke with Dr. Joel Bennett, president of Organizational Wellness and Learning Systems, aka OWLS, a consulting firm specializing in evidence-based wellness and e-learning technologies that promote organizational health and employee well-being. He joined me today from his HQ in North Texas. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.